Hello, I'm Dr. Justin Hughes. I'm a minimally invasive and robotic surgeon, and I'm making this video to help educate people if they're interested in possibly choosing this career path and just give them a general idea of what it involves. I use mostly robotics to perform surgery through small incisions for patients that have medical issues that will not get better without performing a surgery. The reason why I chose to become a surgeon is I really enjoy helping people, and I also enjoy complex problems and having to put a lot of thought into finding solutions. I feel like it really challenges my brain, and I enjoy that, and I enjoy always learning because when you work in the medical field, you're always learning. There's always more things to learn, and there's new technologies that are developing. And it's ever changing, and that's something I really enjoy about the field. I feel like I never have a boring day at the job. So some things that are important to develop if you're thinking about becoming a surgeon. Surgeons are doctors, so you go through medical school, but before you even do medical school, you have to go through 4 years of college. Not everyone finishes college in 4 years. Some people change their path in the middle of college and extends it, but the main thing is they want you to obtain a bachelor's degree. Most people pursue a science degree, but you don't have to. I had many classmates who studied English and literature, other things, art, music even, and then they decided to pursue medicine. There are some prerequisite science classes you need to take before because you have to take a big test to apply to medical school. Medical school is very hard to get into. It's very challenging. A lot of people apply and only a small percentage of people get in. So after you're able to go to medical school, then you do 4 years of medical school training. And at the end of medical school, you choose a specialty to go into. So I chose the specialty of general surgery, and you do a residency. So at this point, you're a doctor in training. You go to somewhere in the United States, wherever you match, and you do training under other doctors that have already finished their training. So that general surgery training was 5 years. After those 5 years were up, I could have chose to do another extra training if I wanted to do heart surgery or other types of surgery, but I chose to do minimally invasive and robotic surgery, and having a general surgery training was enough to do that. So that's what I chose to do. To be successful through medical school and all that training, it takes a lot of time and effort. You have to be very regimented in studying. You have to be someone who can follow a consistent schedule and be able to really get things down through a lot of time and effort. But it's definitely important to take care of your own health too, and to schedule in time to exercise and spend time with family. Just because you're doing that training that's very regimented and can be very time consuming doesn't mean you don't have time to spend with people as well. You still have yourself to take care of, and the people in your family as well you have to look out for. So that's kind of a general overview of my profession. Thank you.